start the debate. Good afternoon, everyone. We're here starting. As our kind presenter said, this is the last panel of this event. See what honor we have precisely to be here on this stage for this closing session on a topic that to us is so important. We are health leaders, and we've seen various health leaders this week going over to various stages, showcasing their knowledge, their sharing their knowledge and their charm. And at this moment, we're going to have the opportunity of closing this event. As Americans say, last but not least, we have our task to continue. We still have 40 minutes to show the work that we've been doing, and Danielle, for almost 2 years, if I'm not mistaken. Although you've been introduced and you made a beautiful presentation of our panel, of our chat, I'd like to say that I'm here with two friends. An old friend, who is Danielle Greca. Danielle Greca is a manager that for a long time follows the health industry in our country. I've had the opportunity of having him helping us when I was president of ENTREPRENEURSHIP, and I'm still chairman of CBEXs, and also in the union, we've talked sometimes, somebody who's very familiar with the health industry, somebody who kicked off this project when at the time he was at KPMG, and we're very grateful to that. And the other great friend here is Leonardo Giusti, this man who's already been introduced to. He's here with us again. I had the opportunity of being with them within this perception of this wonderful company that is always connected to associative topics that are important to our industry. And they end up producing contents, and not only producing contents, they end up helping the industry in the development of contents together. And they have interesting contents at ANP, at the DEX, and we have opportunity of talking about CBEX. And also, yesterday we completed a beautiful project. Everybody's invited to see, which is our room of CDOX, but it's powered by KPMG. In addition to several books we've translated together, and hopefully we'll be translating another book by Mike that we can actually complete all this close relationship of contribution that you have with the health industry in our country. So I feel very much at ease. I'm amongst friends, and I know you're very updated with this work that we try to carry out. Danielle, that I followed from the beginning of his career until now, because he's helped in the closing of it. We actually have an interesting article on this atlas. And the atlas is basically what the name says. it's an atlas. It's where we seek information, and every now and then we want to have all institutions that are providers that somehow are connected to society. They serve the society through purposes that somehow bring a content to this society. And one of the projects that these entities can provide is to make the society to understand what the industry does, how it is organized, how it is structured, and those that are part of the entity understand how they are related. And more than this, they can be compared and perform the famous so-called benchmarking. So the instrument we've developed together, the Atlas by CBEX, it first outlines the profile of the health leader in our country, and then it outlines several discussions regarding, amongst other things, the difficulties and what is expected, what the leader needs to know. And because of that, we, in an ascertained way, proposed by KPMG a discussion of the new digital leader so that we could understand how much this market of ours will depend on this new transformation that we're going through, which is the digital transformation, how we, business people, can be inserted in it. So I'm going to ask you to comment for 10, 15 minutes what you've seen, what you can comment on the Atlas. I know you've had access to it and you took part at different times, but you know the final result so that we can later continue with our conversation. Let's start with Daniel. I see on my screen, he's at the top, right, Leonardo? He's first. So up to you now, Daniel. Thank you, Balestrin. Now let's start with the youngest. First of all, it's a huge pleasure to be here at the panel with you and Leonardo. I love to hear your comments and provocations of the panel about leadership. I'm here with my former leader. Leonardo has been my leader for 3 years, so I was led by him. I'm amongst friends and the health leaders. I'm very happy. The work of the Atlas Balestrin has been a great accomplishment for the health leader. It brings insight and more than that, the situation as to how leaders see themselves, the executives see the market, and how they see themselves. This diagnosis is very important so that they can have provocations and look into organizations, our ability as leaders, and be able to improve, to be a better leader. I commented to you yesterday. I was taking part at an event at NHF CBEXs of Australia. They said below their logo, better leaders, healthier community. I thought their idea was brilliant because actually leadership transforms and makes us deliver and honor our commitment to our patients. So believing in more on people and human capital. I'm going to quote you. Human capital is our greatest challenge and our main solution. As to the Atlas Balestrin, I'm going to stress some things that drew my attention, some positives, some I was a bit surprised, and I think it's worth reflecting upon. There's a point in the survey or research study that covered the whole of Brazil, all the links of the chain, health operators, industry, professional services. It was very plural. It's a first edition. As we have other yearly editions, we start having a film, no longer just a snapshot. The first thing that drew my attention is that when the leader is interviewed and asked, he understands there is a lack of understanding of general leadership in Brazil. This drew my attention. If this is a gap or a flaw, how can we think about as a whole? Health does not happen only in its vertical. If you do not understand how the parts communicate, it's important for the leader to understand health as a whole and not only the feud, the silo where it is operating. whatever link it is. Second thing that drew my attention, still talking about gaps, maybe connected to the suggestion of KPMG of adding the digital part to the study. Most people said that digital health understanding, there is a great gap, both in the leaders and lack of understanding as to how to place digital processes, digital care in a world in which you cannot go back. Digital health has no return. It's a way with no return. It's in the pipeline. We have to understand that. This concerned me a bit as to how we have to improve as leaders within our organizations, knowledge, understanding as to how to digitize health. Another point that drew my attention, I'm going to make it as a provocation, if you allow me. When we asked executives how they assess themselves in some skills, we put 6 major ones. It's their own self-evaluation. The 6 skills, 5 of them, 80% reported that either they fulfill fully or more than fully. This surprised me. If this is true, I think there is a surprise that is very pleasant. 6 skills, out of 6 skills, 5 of them, 80%, either complete fully or more than that. And I thought in a provocative way, how able are we to make this self-analysis? How humble are we to recognize that we're good enough, but that we still need to improve? And then I connect to humbleness is one of the features that is most relevant of the new leader, the ability for them to be able to analyze themselves, humbly understand their limitations, even change their mind or revisit the process. So in this process, digital health, this is very important. How can you learn a lesson or learn from a flaw that you've had? Well, this drew my attention. If it's true, great, but we should provoke and understand whether we're really making a proper self-analysis. Still talking about self-analysis, the only point executives said they did not comply or attain fully is digital health. That connects to my previous point in which digital health may be the greatest weakness of health executives in Brazil. Another point that drew my attention is when we asked the executives, what is the skill they admire most in their leadership? And skill was leadership, the ability to lead, to communicate, to engage, being transparent, of being able to train new leaders, not simply lead an organization. Those I've worked with, inspiring leaders that have all those skills, have suddenly realized that this makes a difference. Leadership actually transforms. Some other points before I conclude and hand over to Giusti. When we talk about challenges from now on, talking about the future, not 2100, but 2022, executives reported digital transformation as their first and main challenge. Digital is part of the agenda as a way of your knowing how to do it, ability that you see in your leadership as a challenge in the industry overall. Other items here that have been mentioned, I'm giving you lots of spoilers, but anyone can download the study, have access to it fully, is mental health. Healthcare professionals, this is not a problem of today. It was pre-pandemic. The pandemic actually catalyzed or all of that. So this is very important in terms of patient care and also management change. This has been highlighted as executive as a pain problem when we talk about changing leaders. Those are the changes in organizations, be it structure, new jobs, new business model, or operational model. So this is a bit of my spoilers, Balestrin, a bit of my analysis and some very personal opinions, how I viewed the Atlas. And again, I think it's been a very good first study for us to make others in the forthcoming years and see how things are evolving. Very good, Danielle. Thank you very much. And then we're going to discuss, if you meant what we have is excess humbleness or lack of humbleness in the industry, but we're going to get there in a while. Danielle, okay, thank you. Giusti, you who are a leader contesting this group, well, the stage is yours. Thank you, Balestrin. It's a pleasure to be here, Danielle. Great pleasure to share this panel with you. First, I'll apologize because Murphy's Law actually disconnected me twice on the computer, and I'm connected via mobile. It's a bit more stable, but there's a bit of improvisation in the camera. It's first of all, it's a great satisfaction to be here, Balestrin. Thank you for the invitation, the trust you had on KPMG to support the drafting of the first atlas, and thank you for inserting my article. I'm afraid the line has been cut. He lost connection. I think his connection has dropped. I stopped hearing him. Okay, whilst Giusti, I saw he was disconnected a couple of times and he came back quickly. Well, in the meantime, let me ask you a question that also drew my attention. I don't know if Giusti was going to comment on it or not, but the fact that we have few, I don't mean little diversity. What we realize is that there was great respectability of executives and health leaders regarding their institutions, where they say there is respect towards diversity, be it cultural, gender, sexual option, it doesn't matter. They say it exists. But on the other hand, when you get the surveys themselves, you see a very reduced number of Black people and of other ethnicities or races. How do you see that? Do you think it's a problem in the sample, or this is really the design that we have? I also paid attention to this. I remember the data exactly. 80% of the interviewees reported that in their organization there's some initiative regarding inclusion and diversity. This is very good. So for me, before reading the result, I would never say 80, but I was very pleased. We are still on the learning curve to putting it in practice. One thing is you are having the initiative. So 80% said they have this initiative in their organizations. So the second thing is seeing these results in the structure at all levels, from the board until those providing care. It is a matter of time, perhaps. The world is moving towards that and maturing in terms of inclusion and diversity. If today we see that there is the initiative in the great majority, perhaps next year, 2 years, 3 years, we start seeing the results of this in practice in inclusion and diversity. I don't know if I'm being optimistic, but since this is gaining more momentum now, perhaps it's a matter of time. Giusti, come on, let's go. You're on board again. Now you have no sound. Thank you, Balestrin. Let's try. Health is driven by carbon and concrete. All of a sudden, we realized in March that we would no longer have access to health via carbon and concrete. Our great transformation speech is based on telemedicine. The great weight to us is that the digital transformation is the upcoming of telemedicine, and it happened the way it happened, and there is no return. But it needs to advance a lot on various concepts, in my view. But I think it is quite interesting to think about some of the topics on the atlas that coincide with the studies that KPMG has been developing here in Brazil and internationally. I've mentioned here in my article, Balestrin 3, that bring elements that actually confirm and endorse the view of the atlas in terms advanced during the pandemic. It brings the perspective that digital transformation is a need for the health industry, but it brings this counterpoint as to how much it advanced. but we just invented telemedicine. But 72% of respondents said they haven't started and are about to implement. We also have another indication that 72% has not implemented any digitization program. 80% are still working on how and thinking about how to integrate patient data considering full care. And 87% said they haven't started or are about to start data analytics. So Balestrin, we have two phenomena, many respondents, 75% of them on the Atlas saying that the pandemic has sped up and digital transformation is necessary, and it's actually a reality. But many pieces of information brought by the Atlas of a huge space for us to move forward. And since we are at the chapter of human capital, the executive, what is our role into it? I mentioned this in my article. It's no use connecting, having robots, telemedicine, wearables, data, because the service, those that provide service and care in health are human beings. Because Balestrin, I think there is a huge challenge as to how to make digital transformation and cultural transformation, the development of leaders, and they should all move hand in hand. We know that it's no use having a great car if the driver is not prepared. They won't even manage to get out of the garage. So this is how to bring the human capital to the context of the digital age. We're very much based on the digital, on the industrial, industry or industry age, in which we build relations with no multiple stakeholders with not a lot of information, and the main agent is not necessarily the client. The digital age drops it all. So today we build a network. We put voices to patients, to doctors, to the industry, to the researcher. And how do we make it all to happen? I think we have a great challenge of actually mindset. I think it is fundamental for us to address this topic. We have moved, or we've gone through a period of 18 months of great challenges to all of us to bring the professional context into our households, balance anxieties and expectations of the families, and make everything to work has been, is still in some situations, a huge challenge. And returning to a life that is a bit more normal, in which we try to separate work, family, and household, will be as difficult as it's been for us to get used last year. So this is an important topic, goes through mental health, Danielle mentioned, which is actually our taking care of human capital in this transformational context. Otherwise, you may have data, robots, connection, but it won't take off. Here, I'd like to congratulate CBEX for the initiative, for the journey up to now, for the initiative on producing the atlas, and the role and the goal of CBEX is actually quite noble to bring to discussion the human capital in the context of transformation.
That's great. Let me make a comment here, not about what you've just said, but something to guide into our next topic. In our Congress of Brazilian executives in healthcare, and you are members of this group, you know that we based on 3 elements. First, knowledge. And as Daniel pointed it out, you try to obtain homogeneous knowledge among all the different links of the chain that are part of CBEX. The health executive, and it's important to say it, when we were approaching health executives, and there were 1,530 respondents to our survey, a very large number, including all Brazilian states, the whole country, 26 states plus federal districts. So it is a national sample. It shows average age. We know the average age of Brazilian executives in health are about 45 years. Executives or health leaders are those who have under their responsibility materials, medication, resources, people. These are leaders, regardless of being a CEO or as part of a team manager. They are all health leaders. Health leaders are also those which are in different areas, for example, hospitals, clinical labs, pharmaceutical industry, HMOs, and private and public likewise. There is interchangeability of people from all sectors. Daniel, for example, who used to work in consulting, now works in one of the largest hospitals in Latin America, Hospital Sírio Libanês in São Paulo. There are others who have worked for pharmaceutical companies. Now they work in HMOs, HMO managers who then moved to hospitals, pharmaceutical industries who moved into different players, but always within healthcare. They are all health leaders, and this is why we have to work as a group to have a clear understanding, a homogeneous understanding of healthcare. We should not be given the impression that everything lies within the hands of your friends or of your organization. This is an important aspect because leaders should have a comprehensive understanding. They should have a clear capacity to indicate the best way to follow different circumstances and opportunities. I'm sure you are all familiarized with all of that. So how can we do it? By disseminating knowledge, such as preparing documents such as the atlas, because if nobody knew who the health leaders were, now they are all known. We know health leaders are primarily Caucasian. They are primarily men. There is a trend, which is something very positive, a trend of having more female leaders in healthcare, which is better for health, because women are going to bring more soft skills on board and seeing management in a more people-centered care, people-centered way. And we can learn from different people. We can have an open dialogue and hear different perspectives, sharing a broad range of knowledge. These are health leaders, and through documents such as this and congresses that we are shortly going to have on site, or events and conferences such as this. And let me greet my dear friend Giusti and Rodrigo, who are the people who end up really organizing this conference. So accept my warm greetings. But by doing that, by sharing, we become empowered people, we become leaders. And this is exactly what we showed in our survey. Said that, what are your impressions about diversity? Can it be useful for companies and for healthcare? Secondly, I would like to hear more about digital transformation. The first question that a health leader has is always, I have to learn more about digital transformation. I would like also to ask you to talk about Brazilian inequalities. And we know that São Paulo, the South region, the North region is different, the Northeast, South, we all have different needs. And we are at different levels of incorporation of technology, of adoption of telemedicine and digital transformation. If that's the conversation, right? I could be here on and on talking to you, but soon we'll be free from the conference. Maybe we can get together, have a drink and start and continue talking. Okay, so let me hear from you, Leonardo. Well, let me start addressing diversity. The Atlas brings some data that says that 50% of leaders are not people who trained in health. It promotes bringing experience from other sectors. So health executives now have an opportunity to grow and to expand health, but beyond promoting well-being and health, but as part of a whole chain. There is another important topic to be addressed, which is to break with silos. We talk a lot about that. Going into digital transformation and connecting that with diversity, we have different silos as well. The incentives in each silos vary. As we promote an exchange of experience, bringing together professionals from different areas, industries, and departments, we can really move towards breaking with silos and really moving ahead, and we will all benefit eventually. I believe that digital transformation, trying to connect all the different regions we have in Brazil, is always a challenge. In São Paulo, the experiences are different from the experiences that we may have in Curitiba, just to tease Daniel. And that's going to be different from what we have in the North and Northeast. Well, unfortunately, of course, this large country with an even distribution of income is something that really impacts all of us. It prevents us from having homogeneous distribution of services and realities. But we have to do more with the same resources we have. We have to do more with what we have at hand. And digitalization is going to add to efficiency. It's going to give us more interoperability. It will reduce redundancy and waste. Apart from fraud, of course, which is not going to be addressed now. But if I carry on, I'll just speak for the whole afternoon. You know me, I keep on talking and talking. But let me hand it over to Daniel. Thank you very much, Balestrin, for the opportunity. Just so little time. Health is topic we all love to speak about, so I could really be here the whole afternoon. So Daniel, back to you, but thank you, Balestrin. It's been an honor to contribute to the Atlas and also share this panel with you and Daniel. Balestrin, Giusti, I think diversity, 80% of the respondents said that they had some ongoing initiative in terms of diversity, and we are going to see that in future editions. So yes, there is a benefit of having diversity. If innovation is a problem and digital transformation is a problem, how can we innovate if there is no diversity, if it's not a different setting? It's difficult to innovate if you just have the same. If our challenge is innovation, transformation, we need a setting with plurality, a diverse environment. And I think that leaders should really convince those led by him that they belong, that they are part of the organization. And this leads naturally to more projects, to more ideas. It brings really, and it makes us start walking our talk much more naturally. This is all connected with digital, and KPMG had many studies like that. So digital transformation, innovation, in 80% of cases fail because of people, because they do not know how to do it, because they resist doing it, because they have no talent, or because it was not part of a strategy in which technology becomes a means and not an end. So things are all interconnected, and we are always going to talk about it and get to the leaders, because leaders will generate, bring diversity, set it all in motion, and go from a talk into really a practice. Well, technology really helps us if we think that Maranhão has 0.5 doctors per inhabitant, whereas Brasilia has 4.5, technology can help. But we need quality, we need appropriate training of our healthcare professionals, regardless of being in clinical practice or not. It would take more time to talk, but it involves also education. But we leaders are ultimately responsible for that. I think that if we don't have what we are looking for in the market, if we don't have the talent or the number of talents we need in the market as a leader, as an organization, you have a new responsibility. Create it, develop the skills that are not found outside. So this is a teasing to all of us, a teaser to all of us. What have we been doing to really train the future health leaders in Brazil? Daniel, Leonardo, that's great. Daniel and Leonardo, yeah, sounds like you do it. Yeah, sounds like you do it. You can go into singing. Well, it's been wonderful. I had asked the organizing committee to show a QR code of the survey. I think it's not the one we can see on the screen. It's okay, no problem. If you are interested, we can send you the QR code. And I think that after everything we've said, I am sure that most of the participants would like to see the results of the survey. So please just visit www.cbex, as you can see, cbex.s.com.br. There is a banner, and it can take you to the results of the survey. Well, thank you. Thank you all very much. I think it was wonderful. It was wonderful to be here with you and to have this informal conversation among friends. Because I think that all of us as leaders, we have to show people that we should build trust, friendship, and love. Thank you very much. Have a nice bank holiday. Have a nice weekend. Bye-bye. Thank you.